Dr. Salim Surani joins us live to discuss the surge in Omicron cases and what parents can do as kids start school again this week. Good morning once again, Dr. Surani. So good to have you here. And Dr. Surani, what do you tell those parents that have mixed feelings about sending their kids back and they're fearful of the conditions within their school buildings?
Good morning, Dr. Here. The main thing is Omicron is very different. Even if you look across the nation, transmission rate is very high. The hospitalization rates though remain low, but on the other hand, you probably hear a lot of news that hospitals have a shortage of staff and shortage of the beds. The reason is that the staff shortage is the key thing compared to some other variant where the hospital beds, a physical bed was a major concern. What is happening is that this variant is very different. Even if you're immunized, you can still get the breakthrough infection. The healthcare workers are no different. So when they go out in the community, they catch the infections. A lot of the healthcare workers are getting infection. They're mild, they're not very sick, but when they're infected, they have to be quarantined. That takes them out of the workforce. A lot of the hospital in Houston, and they have lost 40 to 50% of their staffing at least for 5 to 7 days. That means that they have to cut down the number of the hospital bed which they can serve. Now, same thing can happen in the pediatrics because the number of the hospital in pediatrics is increasing, but not to the extent as the adult. So what the parents can do, number one, if your kid has not got vaccinated, if they can, they should get the vaccination. Second thing, now the booster is getting approved for the kids above 12 years of age. So you need to make sure that they can get the booster and they can do their part. The third thing is nothing subside your duty to wear the mask. And this, in this case, we know that the cloth mask does not protect good. So you need to wear a three-ply mask or a disposable face mask. The fourth thing is you need to keep the physical distancing, wash your hand, disinfect the surfaces. And again, if you are sick, that's the most important thing. If you are sick, if you have a signs or symptoms which points towards the COVID or any of his infectious etiology, you should not be going to the school. You should be at home so that you don't make your bug and go ahead and give it out to the community. If anyone in your family is tested positive, then you should not be going to the school. Anyone you have come in close contact who has turned positive for COVID is suspected for turning COVID. You need to make sure that you take a precaution, be at home, and keep everyone safe.
And Dr. Surani, what are the CDC guidelines for those students that have been exposed to COVID?
One of the things is if you're exposed to the COVID and you're waiting for the test, you need to avoid going to the school. If you're positive, then you need to be at home for 5 days at least, and preferably 10 days. And you need to make sure that you're asymptomatic.
Dr. Surani, as always, thank you so much for being with us. We appreciate all of your help and answering all of our questions. If you do have a question for Dr. Surani, super easy. All you have to do is text it to the number on your screen, 361-855-6397.